Impact Health Sharing is a not-for-profit, non-insurance alternative to the high cost of health insurance. It's a community of individuals, families, and small businesses just like you who share and pay each other's medical bills. But you may ask, how does Impact actually work? When you become a member of Impact, you'll first activate your Impact Share account. Your Impact Share account is a financial account owned and managed by you and is used to manage all sharing activities. Once a month, members deposit a specified amount into their account. This amount is unique to you and your household, and it's called your monthly share. Share dollars are then matched and allocated to another member who has an eligible medical bill that needs to be paid. Once all or a portion of your monthly share amount has been matched to a member, Impact will notify you as to whom you have been matched with and how much of your funds they'll receive. We call this publishing. Once notified, funds are transferred from your share account into their share account. When the member has received the full amount needed to pay that medical bill, it is then sent electronically to the medical provider and paid in full. The process works the same when you have a medical bill that needs to be paid. What does published for sharing mean? When we say published, we're referring to how our members are notified that a bill is ready to be shared and that a portion of their share will be used to pay that bill. You can also go online to see the aggregate amount of all the bills that are published and shared among members. So you might be wondering, will everyone see my medical bills and personal health information? We will only publish the name of the member household that has a medical bill, the total amount of the bill, the names of the members who have been matched to pay that bill, and the amount they have been allocated to share. We value your privacy. We never publish personal health information. What happens when you go to the doctor or hospital? It's simple. When you go to the doctor, all you need is your Impact ID card. The membership card provides your medical provider with all the information needed to submit your medical bills to Impact electronically. There is no need to go through the hassle of collecting and submitting medical bills yourself. Your medical provider will do this for you. Upon receipt, your medical bills are repriced and discounted, and then reviewed pursuant to Impact guidelines for eligibility. If a bill is eligible and you've met your primary responsibility amount, or PRA, for the year, your medical bill will be published for sharing. What is your primary responsibility amount? The primary responsibility amount, or PRA, is the annual amount that every member household is responsible for paying before any of their eligible medical bills can be published to the members for sharing. With Impact, you will have 4 PRA options to choose from to better fit your budget and needs. What is my coshare? The coshare is the percentage of an eligible medical bill paid by the member after the primary responsibility amount has been met. As an Impact member, once your PRA has been met, you pay 10% of all eligible medical bills. The remaining 90% is published for sharing to the Impact membership. However, the total coshare amount which you are responsible for is limited to $5,000 annually per household. For example, let's say you choose the $2,500 PRA option and your family has already had a number of eligible medical bills that have met your $2,500 PRA. Then someone in your family, perhaps your daughter, has an accident. You take her to the emergency room and the medical bill is $10,000. In that case, you would pay a $150 copay to the hospital, as well as a 10% coshare amount, or $1,000, to the hospital. The remaining $8,850, 90%, is eligible for sharing by Impact members and would be paid directly to the hospital by the Impact members. Now, let's say in that same year, something happens to you and you need to have surgery, and the procedure costs $70,000. You might think that your coshare amount is going to be a full $7,000, 10%, but it's not. The reason is because you already paid a $1,000 coshare when your daughter got hurt, and you can never pay more than $5,000 in coshare amounts in a given year. So in this case, you'll pay the hospital the $150 copay and only a $4,000 coshare amount. The remaining $65,850 is eligible for sharing by Impact members and paid directly to the hospital. If you or a family member have another eligible bill in that year, then 100% of the bill after your copay will be eligible for sharing because you've met your PRA and coshare limits. Why do I have a balance in my account? In order to process and pay medical bills quickly, Impact Health Sharing implements a practice called distributed or decentralized reserving. Impact is not insurance, and we do not collect and hold medical reserves in a centralized bank account. Instead, the monthly share amount is set at a level to build a small balance or reserve in each member's individual share account. These distributed reserves enable Impact Health Sharing to better manage the fluctuation of medical usage and payments. We hope that this video will help clarify the Impact membership. To find out more, go to impacthealthsharing.com or call us at 855-378-6777.